Leaving for college is an exciting time, but for today's guest, that excitement came with some health concerns, including unexplained weight loss and exhaustion. What was causing her symptoms? We explain the diagnosis that could also have put her heart at risk. Good morning.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Erin Vogel did what every young person should do before leaving for college. She had a checkup with her primary care doctor. But in that checkup, she noted she hadn't had a menstrual cycle in a few months. And that, combined with the other two symptoms, led to a surprising diagnosis.
I was diagnosed the day before I went to college.
It's not the news anyone wants to hear the day before heading off to college, especially parents.
They definitely worried. I think any kid going off to college, parents are gonna worry, and so I think they were disappointed that this was an added stress for me.
Erin Vogel blamed cross-country running, along with graduation and college preps, for feelings of exhaustion. But at a physical on the eve of leaving for school, she told her doctor she hadn't had her period in several months, which led to testing and an unexpected diagnosis.
So I was told I had Graves' disease, which I know is an autoimmune condition that affects my thyroid. It makes it overactive. That's probably all I knew at the time.
Erin is active and loves to run, but she was put on medication and was told she wasn't allowed to work out for the next several months until doctors knew it was under control. Graves' disease can cause the heart to race, putting added stress on this vital organ. But Erin was fortunate. The medication worked, although doctors don't always prescribe it indefinitely.
Your thyroid can go into remission, and several times my thyroid levels went immediately off, and so that didn't work. And then I was finally done with it, and actually right after grad school I planned to get the ablation, and my thyroid levels were normal for a year without medication.
It seemed like perfect timing because Erin and her husband were ready to start a family. The medication Erin was on could be harmful to a fetus, but an unregulated thyroid can be just as dangerous. After they'd already started trying to get pregnant, Erin's thyroid levels changed again.
I've always had open communication with my doctor, so I really trust her.
Erin's doctor put her on another medication to treat Graves' disease called propylthiouracil, or PTU. It's safe to take during pregnancy. Erin adjusted to the medication quickly and just in time.
Any news on the pregnancy front?
Yeah, we're 10 weeks, so.
Oh, congratulations.
Yeah, thank you.
That's so exciting. Congratulations, Erin. We are so happy to have Erin Vogel on today's program, along with her endocrinologist, Dr. Lee Eck. And we're also joined by cardiologist, Dr. J.D. Surface. Now, Dr. Surface, you didn't treat Erin, but you are a heart expert, and you're here to talk to us about, you're a cardiologist, so of course you're a heart expert, but you're here to help us understand why there are concerns about the heart for some thyroid patients. I want to start with Erin, though. First of all, can we see your whole wedding album at some point? Because those were beautiful pictures.
Thank you.
How are you feeling today?
I'm feeling really well, yeah. So second trimester has been a little bit better than the first. But
are you having any nausea or anything?
Not right now. A little bit tired, but other than that, I feel great.
And what's the status of your thyroid levels now? Because those can go into remission, go up and down.
Yeah. So actually, from the day that I found out I was pregnant, my thyroid levels have been normal without medication. So I've been really fortunate.
So are you no longer taking the PTU?
No, I'm not taking anything right now. So
that's awesome. Yeah. Well, congratulations on that. That's one less thing you have to take or worry about.
It is, yes.
Dr. Eck, you shared with us some images that show the symptoms of Graves' disease, and I want to talk about this a little bit. The symptoms are nervousness, weight loss, feeling like your heart is racing, hand tremors, trouble swallowing, change in energy level. Looking at this, Erin, which were the ones that now looking back you had?
So I definitely noticed a change in energy level. I was extremely tired, and then I'm trying to think, other than that, just weight loss, I think.
And unexplained. Was it a lot, or was it like 5 pounds?
No, I think it was like 10 to 15 pounds, yeah.
Which is a lot on your frame.
Yeah.
And you'd missed a couple of menstrual cycles as
Correct,
well.
yeah.
So that's another red flag. So Dr. Eck, I want to bring you in, and full disclosure, you're also my endocrinologist, because like Erin, I was diagnosed with hyperthyroidism bordering on Graves' disease, but I've been in remission now for more than 3 years. So you might be in remission for a very long time, hopefully forever.
Hopefully, yes.
Dr. Eck, what's it like to see your patient back here now? You've treated her since she was a college kid.
Yes, it's awesome to see Erin here. We were just comparing notes. I had forgotten that Erin went to K-State, which is where I went to school, and I met Erin when she was a college student, and I got to see her every time she was home for break. And as Erin mentioned, she did have a period where she was in remission and were able to titrate off thyroid medications for more than 1 year. During pregnancy, obviously, it's our preference to not have to use anti-thyroid medicines. So it's really fantastic that we were able to titrate off the propylthiouracil early in pregnancy or right before pregnancy, and that things have been quiet. We've been keeping a really close eye on Erin's thyroid levels throughout her pregnancy, and that's a real gift to be able to be so involved in the care of pregnant patients as an endocrinologist.
How common is it to go into remission? Because the same thing happened when I was being treated. You go in and you're in remission, then all of a sudden, I'd realize I had the jitters or some weight loss. Is that common to just go up and down like that?
Well, with Graves' disease, we can use 3 treatment modalities. One treatment modality is antithyroid medications.
The PTU that Erin is on.
Methimazole is the preferred medication when we're not pregnant. We do use PTU in the first trimester of pregnancy, but otherwise we use methimazole for treatment of Graves' disease. And once we use methimazole for 1 to 2 years, we can taper down, and if our patients stay with normal thyroid levels, taper off. We can see a remission in up to 60% of patients with Graves' disease after treatment with methimazole. And certainly Erin entered that remission for a period of time. 40% have a recurrence, which Erin did have that recurrence, and unfortunately at a time period where she was making some important choices in life. But that's when we reinitiated PTU, actually, because I think you were wanting to achieve pregnancy at that point in time.
How does the PTU work? What's happening inside the thyroid that's making that medication work and then be safer than the others?
So both PTU and methimazole work by inhibiting thyroid hormone production by impact on iodine. And so they lower circulating thyroid levels, and we can see a lowering of the antibodies that are present in Graves' disease that cause the excessive thyroid hormone production with these medicines.
We're going to get to Dr. Surface in one more second. One more quick question. I want to get to this image that you shared with us, Dr. Eck, showing us what Graves' disease looks like on a scan. Yeah. Can you explain what we're looking at here?
So this is a radionucleotide test, and it shows incorporation of iodine throughout the thyroid gland, and that is consistent with Graves' disease. When we have hyperthyroidism due to a toxic nodule, we'll just see a single focus of the black area, and the rest of the gland will be white in comparison. But in Graves' disease, the whole gland is taking up iodine and overproducing thyroid hormone. So this is what this scan demonstrates.
Okay, so Dr. Surface, I want to bring you in, our cardiologist, for the heart connection here. Now, Erin mentioned she used to be a runner, or she still is a runner now, but Erin was told to back off on exercising until her hyperthyroidism or Graves' disease was under remission. Why is that?
That's a great question. There may be non-cardiac reasons why you may not want to exercise, but from a heart perspective, if you have too much thyroid hormone circulating around, thyroid hormone is sort of fuel for the heart. It amps it up, it makes it run at full top gear.
Right.
So your heart rate may be very fast, you may be having palpitations, the heart beats very strongly, and the blood vessels all dilate. And so if you go exercise, you may not have another gear for your heart to go into to meet your body's demands. And in particular, we worry about abnormal heart rhythms. So high thyroid hormone levels that you see in Graves' disease can contribute to the development of abnormal heart rhythms called atrial fibrillation, and as well as a few others. And if you take the stimulation that your heart has from thyroid disease and then add on the stimulation of exercise, that may be just what's needed to tip you over into atrial fibrillation.
So how long did you have to hold off on the exercising then?
I don't remember exactly. I think it was just for a couple months while they waited to retest my levels.
So this is so strange because I was diagnosed somewhere else in another state by different doctors about 20 years ago. No one told me to stop exercising, and I had the racing heart already. Was that dangerous then to keep going? I mean, I was still going full tilt on everything, but the initial symptom was racing, fluttering heart at all times. It's okay, I'm not going to name the place, but should they have told me to stop exercising for a while?
You know, this is always a controversial topic. I mean, it's one of the difficult decisions we always make when we talk with patients is how much exercise is safe and how much isn't. And obviously it worked out great for you. And the bottom line is that exercise is good for your heart.
Right.
And so as soon as you get your thyroid under control, exercise is still the right answer. In terms of what might have been right for you, I can't really say.
Should have been.
Yeah.
How does the thyroid regulate your heart? We have some images to show of what the thyroid does. Can you talk a little bit about this, what the thyroid does to your heart?
Absolutely, yeah. So your heart is as an organ is really responsive to external stimuli because it has to be, right? Your heart has to beat harder and faster when you're exercising. It beats slower and quieter when you're asleep. And it turns out that thyroid hormone is active in your body all the time, even under normal conditions. And it helps regulate things like heart rate and the force of your heart. But when it's overactive and you have too much thyroid, it'll make your heart race, it'll make your heart beat very strong, and it can dilate the blood vessels to the point where your blood pressure, you can sometimes see high blood pressure, you can sometimes see low blood pressure, and that can really cause your heart to just beat and circulate a lot of blood. And if left untreated for too long, it can even contribute to the development of heart failure.
What about hypothyroid? If the thyroid is underactive, how could that damage your heart?
Yeah, so it's almost the diametric opposite, right? So if hyperthyroidism makes your heart beat fast and makes you feel these palpitations and makes it beat strongly, hypothyroidism can actually slow your heart rate down, and you can have an inappropriately low heart rate. It can actually cause your heart muscle to beat less strongly to the point that it too can actually eventually cause the development of heart failure. One other thing that it can do that's sort of interesting is that it can raise your cholesterol levels, and that can accelerate the development of plaque, cholesterol plaque in your heart arteries, and can predispose you to heart attacks down the road.
So, Dr. Eck, is it common to work in tandem with a cardiologist when it comes to thyroid disease?
Absolutely. Most of our patients with thyroid disease don't have overt cardiac symptoms, and so we can manage the thyroid disease and we don't have to engage our cardiac partners. But sometimes patients with thyroid disease are very sick and even require inpatient stays in the cardiac ICU because of their degree, severity of illness. So in those situations, we definitely partner with our cardiologist in the care of these patients.
So, Erin, how did you come to see Dr. Eck? Did your GP then refer you to her?
I think it was actually a family friend that works through KU had referred us to her because she's really hard to get into since she's so popular. So he had put in the referral for us, and then I'd seen a couple of cardiologists before her, or endocrinologists. Yeah, but
during that physical, your doctor knew what you had described was probably something with your thyroid.
They didn't really know what was causing my symptoms, and so I think she added on some blood work, and that's how they found it.
Okay.
Yeah.
So Erin mentioned an absence of periods. So one of the tests that we look at when somebody is not menstruating is thyroid hormone status. Yeah. So I'm guessing that our primary care doctor grabbed that test because of your absence of periods, and then we did meet after your diagnosis through a mutual neighbor. Yes.
So we've talked a lot about the heart connection and the racing heart and what that feels like. If you are experiencing something like a flutter or a racing heart, how do you know? If you're just sitting, say someone's sitting at home right now and they have this, how do they know it's their thyroid versus a bigger heart problem?
You know, that's a great question, because a lot of the symptoms that hyper or hypothyroidism cause are very common symptoms, and honestly, most often are not caused by thyroid disease. And unfortunately, the only way to know is to go to your doctor, get checked out.
Right.
The good news is that a blood test is usually the first screening test, and is pretty darn good at detecting thyroid disease. And then the way we will evaluate some of those heart-related symptoms, the palpitations, the pounding heart, sometimes it's as simple as an EKG, which we can do in clinic, or even have you wear a heart rhythm monitor to make sure you're not having abnormal heart rhythms.
So Erin had also mentioned something called an ablation. You were considering that before getting pregnant. So I want to bring Dr. Eck, I want to bring you back in to talk about the 3 different options. We know she's on the medication. Next is ablation. Is that where you swallow the radioactive iodine pill?
Yes, it's either pill or liquid, and you swallow that. And that delivers tagged iodine to your thyroid gland and results in destruction of your thyroid tissue. So we solve the hyperthyroidism in that situation, and the patient then develops hypothyroidism, which is pretty straightforward in management. We give them back a medication called levothyroxine and monitor their TSH levels. But they are on that medicine, levothyroxine, forever to treat post-ablative hypothyroidism.
Is it easier to treat than hypothyroid than hyperthyroid?
So there's a little bit less back and forth when it's just hypothyroidism. Erin entered a remission on methimazole, and we were able to see a sustained remission, but then she had a recurrence. So then that involves more lab testing, resuming medication, and reassessment of lab levels after resuming the medication. So there's a little bit more back and forth when we're using antithyroid medicines indefinitely, as opposed to when we just kill off the thyroid gland and render our patients hypothyroid.
Is it just one pill, like a regular sized vitamin pill?
In terms of the radioactive iodine, it's either a capsule or a liquid that you take in our nuclear medicine offices here at KU.
And how much liquid would it be? A shot, a drink?
I haven't ever taken one. I would say less than a shot, but
right.
I don't know.
And then the third option would be having surgery to remove the thyroid.
That's exactly
and
right.
Is that as simple as it sounds? Is it just I've seen some people who've had that. It's just a little tiny cut right here.
Absolutely.
And then you take it out.
So I think surgery is never simple, and it's always associated with general anesthesia, but it is a very small incision at the bottom of the neck. Typically patients leave the same day or the next day, and typically there are no untoward consequences from that surgery. But I think we always have to be cautious and thoughtful about approaching surgery.
And then is life for those patients the same as after the iodine pill? You just go back on a certain medication to keep the thyroid moving?
That's right. We start levothyroxine, and they're on that medication indefinitely.
We have a lot of questions that people have already submitted ahead of this discussion via email, and if you have questions right now for Erin, for Dr. Eck, or Dr. Surface, you can send them to us right now. We will answer them live. We are on YouTube, Facebook, the X platform, and the All Things Heart email. All the links on how to connect with us are right there on your screen. We are everywhere. So let's get to some of our viewer questions we already have coming in. And this one is from one of our Facebook viewers, Marcia. Marcia writes, I didn't know that hyperthyroidism could go into remission. Is it possible for hypothyroidism to go into remission as well?
Generally, our patients with hypothyroidism do not have a remission of that. Generally, we're giving them back thyroid medication indefinitely once we diagnose hypothyroidism. Occasionally, we can see what we call postpartum thyroiditis. So following pregnancy, we can have a fluctuation of thyroid hormone status, initially hyperthyroidism and then hypothyroidism, and then a return to normal thyroid status. But in most patients that are diagnosed with hypothyroidism, that's a permanent condition because of destruction of normal thyroid cells, and they're on thyroid replacement medication indefinitely.
Jennifer has a question. Jennifer wants to know, does Graves' disease itself have any risk factors to the unborn baby? Like if Erin hadn't had her Graves' disease treated, would her baby be at risk?
Yes, we absolutely want to be very conscientious of treating Graves' disease in pregnancy. Untreated Graves' disease would put mom at risk for premature labor, for a baby with small birth weight. It would put the baby at risk for development of hyperthyroidism because those antibodies that are stimulating the mom's thyroid gland can also cross the placenta and stimulate baby's thyroid gland. So we keep close tabs on baby during pregnancy as well in patients with Graves' disease.
Kelly texted. Kelly wants to know if missed periods are also a sign of hypothyroid. Hypothyroid is underactive.
Yes,
Missed
we can
periods
see
as well?
an absence of periods with both hyperthyroidism and hypothyroidism. So that is a time period that we check TSH status in our menstruating women.
Carl has a question about Graves' disease. Carl wants to know, is Graves' disease the most common thyroid disease?
So Graves' disease is the most common cause of hyperthyroidism. There are some other causes, such as a toxic nodule, where there's a nodule or a focus in the thyroid gland that's overproducing thyroid hormone, no longer appropriately listening to our brain. We can also see a destructive thyroiditis, where we get inflammation in the thyroid gland and release of extra hormone. But Graves' disease is the most common cause of hyperthyroidism.
Eddie has a great question, and I like this question because this was something that we talked about way back when I was considering taking the radioactive iodine pill. Eddie wants to know if it's true you can't be around babies or children if you take the radioactive pill for your thyroid.
We do ask patients to avoid children as well as pregnant women for several days after receiving the radioactive iodine pill, because we don't want those individuals to get exposure to the radioactive iodine.
We were, this was years ago, my son was like 3 when we were considering this, and when the doctor said that, and he was at the terrible 3s, and our terrible years went a few years, my husband was like, you cannot be in a hotel for several days right now. I'm not going to make it. But I thought that was so wild that was the case. What about pets? I'm just asking for me now. Can you be around your pets after you swallow that pill?
So the dose that we use in the treatment of hyperthyroidism is very low. We also use this pill in thyroid cancer at much higher doses.
Okay.
So I probably would offer caution depending on the dose allotment. And we also seek feedback from our nuclear medicine doctors about the timing of the restriction of being around other people and the duration of it.
Bonnie has a question for Dr. Surface. Bonnie wants to know what's more dangerous to the heart, underactive thyroid or overactive thyroid?
Wow, it's a great question. I think the answer is that both of them can be dangerous to the heart in different ways, and it's important to get those problems promptly recognized and treated.
June has another question. This one's for you too, Dr. Surface. What do you do for heart palpitations? Is there a pill to slow down your heart?
Good question. So if you have heart palpitations that are related to thyroid disease, the most important thing to do is get the thyroid disease treated.
Right.
But as you heard, that can sometimes take a while. You may be on methimazole or propylthiouracil for up to a couple of years or maybe more. And there are medicines that we use to help treat the palpitations, typically a class of medicines that we call beta blockers, which are very commonly used medications, especially by cardiologists, that really can slow the heart rate down and tamp down on those palpitations.
There was a pill that they had suggested for me. It was really common. Do you know the name of?
So we always start a beta blocker when patients present with hyperthyroidism, because that will acutely help with the symptoms. A common one that we use is atenolol, or propranolol is another one that we use.
That was the one that I almost took, and then it went into remission. It was so sneaky how it kept coming and going, and it was the strangest experience, Erin. I'm sure you can relate to that.
Yes.
And so strange how you can't control whether or not it goes into remission. I mean, the pills help and such. And Logan has a question for Erin. Logan wants to know, and I think we touched on this, how long you had to wait before you could run again. Did you say a few months? Or
I think it was a few months, and I think part of that was also like the weight loss. I just didn't want to exacerbate that with running, and so I think it was twofold, but I think it was like a couple months. Because I think it takes a while for it to show up in your labs, how accurate your
so I think
are.
once we get patients started on a beta blocker and slow down their heart rate, then exercise is a good thing to add back to the mix. And Erin's exactly right. Once we start antithyroid medication, generally we're looking at labs again in 4 to 6 weeks. So Erin was probably waiting for an update from her doctor to have an understanding of if her hyperthyroidism had improved or if it was still out of control.
Alice has a question, and this happened to my aunt. Alice wants to know, why do some people's eyes bulge out from thyroid problems? Is it fixable?
So in Graves' disease, one of the issues that can present is something called thyroid eye disease. So those antibodies that stimulate our thyroid gland and result in excessive thyroid hormone production can also result in swelling around the eye and behind the eye, as well as inflammation. And thyroid eye disease can be very severe. We do have treatment modalities, and we partner with our ophthalmology doctors to manage thyroid eye disease.
Can it be reversed?
It too can go into remission. So if we can see a lowering of those antibodies that are stimulating the thyroid gland, then those antibodies also will be lower and less likely to stimulate inflammation and swelling around our eyes.
And so the swelling can go down? Because my Aunt Velma, this was decades ago, but I don't think it was ever treated. She just always
had down. And we do have treatment options, including steroids, to dampen thyroid eye disease.
Lewis has one final question, and that is, can you have a heart attack if you don't get your thyroid treated? How common would that be?
Well, I'm a cardiologist, so the answer to the question, can you have a heart attack, is always yes. Because it can happen to anybody.
Yeah.
But, you know, it would be pretty uncommon for thyroid disease to be directly responsible for a heart attack, but it can happen. More commonly, what we might see is if you have unrecognized underlying cardiac disease, for example, narrowings in your heart arteries that are present but hadn't been causing you problems before, in the presence of thyroid dysfunction, that might be unmasked. And so you might see chest pain, that sort of thing. And certainly that should always prompt an evaluation by your doctor.
I've got one more quick question for Dr. Eck. I remember hearing that you should not be around secondhand smoke because it could cause your eyes to bulge out. Is that still the case?
That is accurate. So smoking increases your risk of development of thyroid eye disease by 8 times.
8 times?
8 times.
Wow.
So certainly you don't want to smoke in any circumstance.
Right.
But with Graves' disease, and we do want to avoid secondhand smoke exposure as well, so we mitigate your risk of developing thyroid eye disease.
And so as a cardiologist, you would agree of just stay away from smoking no matter what, regardless of all the risks are bad, all the risks.
Yeah.
I want to bring our entire panel back for some final thoughts. And Erin, I want to start with you because you're doing so well. You look fantastic. You're glowing. What would you want our audience to know who's watching this right now?
I think the main thing is, like any other disease, the key is to be compliant with what your doctors recommend, and as long as it's well regulated, you do obviously a lot better. So work with your team.
Dr. Eck, is she a model patient?
Of course, Erin is a model patient. Yes, it's been so delightful to be involved in her care and see the progression of her health issues, but also see the progression of her life and the wonderful pictures that you shared today of her wedding. And
are you going to bring the baby in to see Dr. Eck?
I will have to, yes.
Have you guys started picking out names?
No, we've thought about names.
Don't tell anyone ahead of time, because everybody has an opinion.
Yeah, that's good advice. That's good advice.
Let's do that. Dr. Surface, what would be your final message to our viewers?
You know, I think I'd echo what both of you have said, which is that it's important to get your symptoms evaluated. You know, like we discussed earlier, there's no way to know just based on what you're feeling at home if the symptoms you're having are related to thyroid disease or not. You need to be evaluated by a physician, get your blood work checked, get examined. And then, pay careful attention to what your doctors are telling you to do. And thyroid disease, thankfully, is usually quite treatable.
We love seeing the incredible work that our doctors do here at the health system. Something else we also love is showing you what life looks like for them outside of the hospital walls.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
Okay, Dr. Eck, you're up first. We're going behind the mask with you and your family. Tell us about the beautiful people in these pictures.
So these are my 2 daughters. I have a freshman in college and a sophomore in high school.
Where does the freshman go?
She's at the University of Arkansas.
Okay,
and she is studying engineering. So far, I haven't gotten her into medicine, but.
Are you working on your other daughter?
We're working on the other daughter for all kinds of things. So that picture actually is from Acadia National Park this summer. We really enjoy the juxtaposition of being out in nature along with the city. So we went to Acadia and then we drove to Boston. So we got to experience both nature and a city this summer for a quick family vacation.
We want to show a little behind the scenes with Dr. Surface now. Dr. Surface, you're new to the health system. Where did you move here from?
I moved here from North Carolina. I was at Duke University for 7 years before coming here, and my wife is from Olathe originally, so we're just happy to be at a new home. We
The
love it
Chiefs
here.
Kingdom.
The Chiefs Kingdom. That's exactly
Now,
right.
you are a Chiefs fan now, right?
I am a Chiefs fan. I'm almost a Swiftie.
Oh, okay, very good, very good. Well, you have daughters, and well, you have sons.
No.
Tell us about there's a woman in your house, so you're a Swiftie for sure.
Yep, that's
and
right.
then tell us about these little boys in the picture.
So I have 3 boys. They're age 10, 8, and 5, which is a real big change for us recently because our youngest, Harrison, just started kindergarten. So now all 3 of them are in school, which is a different experience. Katie actually has time now.
Right, and are you guys sleeping more?
Oh yeah, I mean,
Right.
yeah, the kids entertain themselves.
Wait,
is fantastic.
well, you have more than one, so they get to kind of distract each other.
Yeah, word to the wise, have more than one. Yeah. Wait,
Maybe.
if there's only one, then you're their only playmate.
You know, I shouldn't rule out little boys from being Swifties. Taylor Swift has a lot of fans, and you said that your wife has now gone down the rabbit hole of the Taylor Swift, Travis Kelce romance.
Oh yeah, yeah. Like I said, she wasn't a Swiftie or a Chiefs fan beforehand, but now she's both.
Right.
They're irresistible.
They really are. Well, thank you for sharing your family with us and your time today. Thank you, Dr. Eck. I know you're so busy. And Aaron, you're going to help a lot of people watching this who might be having the same symptoms. Congratulations on your upcoming addition to your family.
Thanks.
Yeah, congrats.
And thank you so much for watching us today. Coming up next week on All Things Heart, years after facing 2 major heart issues, this doctor got a devastating blow. How he went from making end-of-life plans to fulfilling his lifelong dreams thanks to his cardiologist right here at the health system. The incredible story is next Thursday at 8 a.m. We'll see you then.
Coming up tomorrow on the Morning Medical Update. I'm Jessica Lovell. On the next Morning Medical Update, stroke patients were not meant to be this tiny. Meet the parents who never dreamed they'd live this nightmare and how doctors at Children's Mercy and the University of Kansas Health System work together to save their little boy's life. Friday at 8.